Good afternoon. I'm Bobby Regan, a member of the City Club Board of Directors, co-chair of our programming committee and producer of today's program. Thanks to Kayla Kennett, City Club's communications manager, for her support in putting this program together. It is City Club's pleasure to welcome you, our members, viewers, panelists, and moderators to today's program. More than 100 years ago, Portland City Club hosted its first public forums and debates. Since then, City Club strives to be an independent, nonpartisan organization committed to providing space for people to gather and enabling lively conversations and research about critical issues confronting our community. Post-pandemic, in place of traditional Friday forums, City Club will now produce virtual and in-person programming unconfined to a Friday lunchtime slot or a downtown Portland location. We are also relaunching our research board to initiate studies in the coming year. And we will relaunch some issues committees, which are smaller gatherings of members focused on specific topics. Members make City Club run by providing ideas, leading conversations, doing research, and creating our community. To volunteer for our programming committee, our research board, or a specific research study, or an issues committee, please become a member today. Visit pdxcityclub.org/membership and let us know how you would like to engage. We welcome you to our public square and thank you in advance for your support now and into the future. Please save the date for our next program being held in person on Monday evening, January 8th at 5:30 p.m. at the PCC Cascade campus. We will feature Mike Reese, Oregon's new director of the Oregon Department of Corrections. Mike was just appointed to this position by Governor Tina Kotek just last month. A longtime leader in public safety, Mike is committed to rehabilitation and improving outcomes for adults in custody at the Department of Corrections and improving employee wellness. Mike will be interviewed by Antoinette Edwards, former director of the Portland Office of Youth Violence Prevention. Again, please save the date, Monday, January 8th. And now to today's program. Measure 110, the Drug Addiction Treatment and Recovery Act, was a citizen initiative on the November 2020 ballot. Voters passed it with overwhelming support, 58.5% in favor to 41.5% opposed. At that time, Oregon ranked second to last in the nation in state funding per person allocated to addressing the needs of those suffering from addiction. The measure promised to greatly expand access to assessment, treatment, and recovery services for drug addiction. To pay for these services, it reallocated more than $300 million per biennium collected from taxes on legal purchases of marijuana in Oregon. Measure 110 also promoted a healthcare approach to addressing drug addiction by removing criminal penalties for low-level drug possession and incentivizing people to get treatment. Measure 110's decriminalization approach was a first-in-the-nation strategy based largely on decriminalization efforts in effect in the country of Portugal for the last 20 years. With that background, it is now my great honor to introduce our panelists. Each recently participated in a fact-finding mission to Portugal to better understand that country's novel system of addressing drug addiction and decriminalization. Rob Nose serves as Oregon State Representative for House District 42, covering inner Southeast and a small sliver of Northeast Portland. He is currently chair of the House Behavioral Health and Healthcare Committee, where he worked on several significant bills, including one related to ballot Measure 110 operations. Rob also heads up the newly created Arts and Culture Caucus, supporting arts and culture across Oregon. Rob began as a student organizer in the 80s with the Oregon Student Association. He then worked for almost 20 years as a union representative for the Service Employees International Union, or SEIU, and the Oregon Nurses Association. Fernando Pena is executive director of Northwest Instituto Latino. a nonprofit organization offering culturally specific conferences, training, and technical support for Latino professionals in the fields of substance use and mental health. Fernando has extensive experience in training, in motivational interviewing, and has facilitated trainings around substance use screening and best practices for substance use disorder counselors. Fernando began his career in Portland working with adolescents and gang-involved Latino youth in Washington County. He became a clinical supervisor and helped open an intensive outpatient treatment program that included supportive housing in Multnomah County. Aaron Schmutz is president of the Portland Police Association, Portland's police union. He is a second-generation Portland police officer and a 19-year-old veteran of the Portland Police Bureau. He began as a uniformed patrol officer and was promoted to sergeant in 2015. In 2009, he was elected to the Portland Police Association Executive Board. Aaron also serves as president of ORCOPS, the Oregon Coalition of Police and Sheriffs. ORCOPS is a non-partisan statewide organization that advocates on behalf of police officers, deputy sheriffs, and others in Oregon law enforcement. ORCOPS aims to build trust between law enforcement officers and the communities they serve. Our panel today will be moderated by Mercedes Elizalde, who also participated in the Portugal trip. Mercedes was the first in her family to attend college and earned a bachelor's degree in psychology and women and gender studies, and a master's degree in nonprofit leadership. She began as a peer educator at age 14. Mercedes continued in youth development, then began direct service work related to housing and anti-poverty programs. Her desire to address systemic causes of poverty and inequity led her to work in policy engagement. Mercedes served for 4 years as the policy director at Central City Concern and is now the director of advocacy for Latino Network. Mercedes?
Thank you so much, Bobby. Thank you so much, City Club, for having us all here today. Really excited to get into this conversation with you all. Welcome all of our participants. To begin with, wanted to make sure everyone's here for the right conversation. We're here today to talk about addiction, treatment, and the decriminalization of people who have substance use disorders. And most importantly, our fact-finding trip to Portugal.
I'm in the right
to bring
meeting.
us on the same yeah, to bring us onto the same page, I want to take us a little bit back. President Nixon declared the war on drugs in 1971, and it wouldn't be until 2017, 46 years later, that Oregon would change tack and move to make felony drug possession a misdemeanor. In 2020, Measure 10 passed to take that misdemeanor down to a civil violation. In January of 2021 is when the decriminalization actually took effect. September of 2021 was when the first few projects of Measure 110 began to be funded, and it wasn't until July of 2022 that the behavioral health resource networks were actually funded in each county. So here we are 3 years after passage and 18 months into funding, and some are ready to call Measure 110 a failure, ready to call it quits. But we went to Portugal to find out how a country who's been doing this for over 20 years, how did they do it? What was their approach? What kind of course did they take? What kind of training did they engage in? And how did they stay the course and avoid quitting when it got hard? And mostly, what can we learn from their experience? So just to kick off our discussion today, gentlemen, why did you go to Portugal?
Mercedes, which one of us do you want to go first?
I think you should go first since you started,
Okay.
Representative.
So for me, it was very simple. Field trips are good for students and they are good for policymakers as well. And why wouldn't I take the opportunity to go and see the place where what we have been attempting to implement here in our state has been doing now for 20 plus years. So it was pretty much a no-brainer when the opportunity presented itself. And I definitely am glad I went. As I've said to some of my constituents who get my e-newsletter or read my column, seeing is believing.
Thank you.
Yeah, a big part
Aaron,
of
how
why
about
I went Oh, sorry. Yeah, a big part of why I decided to go was you kind of heard about it in my bio a little bit. I've been working in the substance use disorder treatment and recovery field for going on 13 years now. And really early on in my career, I learned about what Portugal did. And so for me, a lot of it was really just going to see something that I've been reading about for over a decade at this point, and really meeting people that in a way are kind of almost heroes to me in the way that they decided to address a very real crisis that they were having and how innovative they were and strategic and mindful they were. And so to really just get there and kind of see it working in action was too hard to pass up. And also a chance to just kind of hang out with a bunch of really mindful, intelligent people who all want the same goal, meaning, all of us, the delegation that went, and to just get to hear their perspective as subject matter experts in their field so that we can kind of put our heads together and see what we can do to really help our communities that are struggling and suffering. So.
Yeah. I mean, Fernando and I had started meeting prior to the discussion on the trip. I think it's so important for us to start connecting with people who might have different perspectives. And in a lot of ways in Portland, I feel like this kind of conversation is broken down. We see a lot of people wanting to kind of shout people down in meetings, or just kind of not wanting to hear why people feel the way they do. And I represent a large group of people who really want to serve, but want to know how to serve. And Fernando and I had met, and ultimately he was the one that sent me the text asking if I was interested in going. And to be honest, I was just as interested in going with the people if they would have said we're going to Bend for a weekend, I would have loved to go, just because I want to connect with all these folks who have different perspectives. As it relates to Portugal, in the last 3 years, I've had several conversations, or I've heard people raise in debate the concept of Portugal. And I think it's really important to ensure that when we're having these conversations and debates, that we're understanding kind of, the framework from which those decisions are made. It was very interesting and fulfilling for me to be in Portugal and hear from the architects of that plan, kind of the root causes of what they were dealing with at the time they chose to do it. There's places that it aligns with our issues, and there's places that it's very, very different. And so if we're going to be making policy based on a model, I think it's pretty important to ensure that we understand what that model is.
And Mercedes, I would add that as a policymaker, it was really wonderful to be able to go with people that are doing work, boots on the ground. I'm not in law enforcement, all right? I'm not even working half-time anymore at the Nurses Association. Like, this is a full-time job for me. And so to have you and Fernando and Aaron and other politicians and other thought leaders and advocates come along with us actually made for a much more rich conversation, because I got to hear from the professionals and the people that are trying to make this thing work, how they think it's going, and hear their learnings as well.
Yeah. And I mean, for me too, I think it's pretty transformational when people, again, just the way that Fernando approached me was, listen, I've had my own experience with law enforcement. I represent a lot of people who have had negative interactions with law enforcement. So let's get to work. That kind of approach is really the only pathway out of kind of the echo chamber approach to solving problems. We've got to have the courage to reach out to people, and I felt committed to the process when he and his group were willing to do that. And it also I think that encourages me to lead the same way.
But we're all working with the same clients, right? Whether we want to admit it or not. The guys, your guys are talking to our guys, our clients, before we talk to them. So we have to be talking to each other to figure this out.
Yeah.
Well said. So when we got there, I would definitely say, I feel like the first things we heard were a lot about history, a lot about what was going on and how the country was being impacted, large numbers of folks who were impacted by heroin. Something I think is a little bit analogous to Oregon. Like, we've seen that there are fewer and fewer people in Oregon who don't know somebody who's being impacted by addiction. So Fernando, I wanted to start with you a little bit about kind of the history there, because essentially we're at the beginning and they were sharing a lot of history with us. What did you hear in some of the history of Portugal and how they got here? And, what was your thinking around what you learned there?
Yeah, the context for their law being changed was that they were taking this kind of war on drugs approach as well. And it resulted in about 1% of their total population being addicted to heroin. That's a bonkers number. Like it's a psychotically huge number, and it didn't include all the other substances of abuse. And they were averaging more overdose deaths a month than the rest of the EU combined, as far as the EU data is collected. And so at that point, they decided well, we have to do something very pragmatic to prevent people from dying, either from overdose deaths or from the chronic diseases that emerge through the use of drugs and alcohol. So like HIV/AIDS and Hep C and all these other stuff. And they had open air drug markets, people dying in the street. And so what they did was like, okay, we decided as a society that they needed to do something about it and be strategic and mindful and pragmatic. And so they collected a group of subject matter experts. I believe the number was 9. We got to meet a few of them, including Dr. Galau. And they said, hey, subject matter experts. And the interesting part, and this was really kind of inspiring to me, was they got subject matter experts from all the fields that would be involved in the changing of the law. So it wasn't just substance use disorder treatment folks. It was people from the education system, from the judicial system, from their executive branch, legislative branch. They got everyone to get scientists, researchers, medical people. And we're like, hey, we're going to give you a year to go out and study this and to come back with some policy recommendations. And that's what they did. And they came back with this very real idea saying, well, let's not do the war on drugs approach. We've tried that. We've seen all the other countries that have done that, and it has failed. And so they decided to do this medical model approach with something that I thought was really, really, actually the most sort of innovative thing that I saw was their Dissuasion Commission, which I know Mercedes was going to bring up later. And then they implemented the law in 2000. And it was a rough go at first, but they knew that they couldn't let the perfect be the enemy of the good. One of the more interesting things about the implementation was, I believe about 3 years in, a conservative government won their parliament and decided that they wanted to get rid of the law. But then they thought to themselves, well, the voters voted for this overwhelmingly, and maybe we should give it some time to work and see what we can do, because 3 years was just not enough time for the implementation. They did a quick, short repeal of some of the parts of the law, and then instantly everyone was just like, yeah, this is not better than what we were. We're just right back to where we were, basically. And so they kind of just gave it to the public health system to kind of start addressing it correctly. And I know that when we were there, Aaron, it'd be interesting to see how you thought about this when we met with the commander of the police. And she was awesome, by the way. And just kind of to hear her approach when we were asking her, like, how do the police feel about it? And she says, 20 years in, you'll still find people who aren't happy about some of it, but it's more that we just don't have a direct framework for how to do it with the seizure of the quantities and the amounts of drugs that are legal or illegal. But this is by far a better way of approaching it. And so, yeah, from a law enforcement perspective, I wonder what you thought about some of that. Oh, I just hijacked the question from Mercedes, so sorry.
Yeah,
It's fine.
so I mean, the thing that was challenging for me, and it's almost like cautionary, right? That you could hear from her. You back all the way back up to 1975. They had a dictator. They had that got overthrown. They moved into a different form of government, and they really leaned into law enforcement around 1985 to institute like a cultural acquiescence to community policing, and really making sure that people had access to their law enforcement. And you see an expansion in the relationship with the government. You see access points to the government be very strong. And then, the one thing that she did say that I think whenever you go through systems like this, you have ebbs and flows. You mentioned one change in government, but then now you also mentioned that everyone was involved and at the table for these decisions. And we also learned that in October, the Parliament changed their law very similarly to the Hubble decision here in Oregon that was going to make DCS prosecutions more complicated, and the police felt like they weren't a part of that conversation. So, I mean, I really felt like the kind of the depth and the breadth of the reality was this ebb and flow of, things work well when we're all involved and we're all at the table, and things work less well when we start breaking from that kind of cooperative agreement.
But
And you said DCS, Aaron,
I'm
can
sorry.
you tell us what DCS is?
So in Oregon, in kind of just general nomenclature, PCS is possession of a controlled substance. DCS is distribution, so selling. Now, and just I guess to unpack that a little bit, the Hubble decision in Oregon basically made it that you had to actually witness the transaction. And I mean, it's a longer conversation, but if you are someone who has significant quantities of narcotics far outside a user amount, if you're someone who has packaging and scales and methodology to help in the furtherance of selling, that historically has been evidence of distribution. And in Portugal, they changed the user amount from 10 days to 30, which is a whole bunch of narcotics.
No, wait a minute. They kept it at 10.
No, didn't they expand it to 30? I believe that they expanded to 30, and that was the issue.
I thought the 10 days was the expansion.
Not the 10
And it
days.
went from a scaled amount to 10 days worth of a personal supply.
I remember 30 days, but either way, it changed and there was a concern, right? And so similarly in Oregon here, the Hubble decision made distribution cases far more difficult to prosecute.
Yes,
and again, these are the concerns, right? We got to make sure that our legislation doesn't have unintended consequences, and the best barrier to that is having folks at the table who are going to be the folks carrying out the work that we're asking them to do.
Hey, really quick, sorry, Rob, just because you're mentioning the Hubble decision, Aaron, I want to just make it clear to the listeners. The Hubble decision was something the State Supreme Court of Oregon did. It was not Measure 110 that did that.
Right.
Right. And so Measure 110, a lot of it is getting all the heat for a number of very complicated systemic issues that aren't actually the fault of Measure 110. And I know that you and I have talked about this before, and you kind of agree with that as well. So not to put words in your mouth.
And I'm pretty sure when the legislature comes into session in February, we are going to deal with the implications of that court case and address them.
And I think it's important for the audience to kind of just really understand that we're talking about whether or not it's appropriate to charge somebody with something that they didn't do, but we're pretty sure they were gonna do, but charge it as if it had occurred. And so I think that's one of those things, like what is the attempt versus the completed and all of these boundaries. And the reason that Portugal, for example, did expand how much illegal drugs people could have on them is because we know that people will also sometimes sell small amounts really just to support themselves, to be able to have enough for themselves as well. And there's all these little gray areas in how it is that people try to attempt to stay well. And I think that's one of the critical parts about a health-based approach, is that it's asking not who are you trying to hurt, but what is hurting you and what are we going to do about that? Representative, did you want to take us in a different direction around?
No, I just want to say that I think that one of the things I walked away with is that there's still a lot of consensus in the country about the approach that they're using. 10 days, 30, all that sort of stuff. Yes. Okay. How is it working on the ground day to day? Yes. But those are the kinds of things that I think people that have to work in a system properly argue about all the time. Like as professionals, like how are things going or not going? What makes our job more difficult, easier to accomplish? I think that's very normal and very healthy. The country is sticking with their approach, despite what we may have read, I think, in some national news media outlets, including like the Washington Post.
Yeah, and I mean,
well said.
We did go to Porto, and I think that we all agree that what we took away from Porto was far different than what was in that article.
Yeah, that was a great part of the trip, actually.
At the end of the day, I just think the real challenge, and to Fernando's point, very often we have things that are a struggle that we have to navigate, and we end up with these kind of confirmation bias issues. It can be true that there are things about Measure 110 that are challenging for folks, but also not everything is as a response to Measure 110. And I think the reason that's so important is if you end up kind of assimilating all concepts to one thing, and then find yourself being disproven, it also invalidates the rest of your argument. So so it's just very important that we understand.
A law enforcement person said it. You have more credibility than I have, so thank you.
Well, we just got to make sure that, again, that we are arguing faithfully to the issues, because there's plenty to discuss. And I also think this is why it's so important that we weave ourselves together, because, again, from a Venn diagram approach, if we're connected even by threads, we're still connected. And it's so important that we stay at the table, just even if we disagree with each other.
Hey, Aaron, because you know, one of the things you and I kind of connected really easily because a lot of what you say, I'm like, man, this guy sounds like a social worker, but he's a cop. And I was making fun of you in
Use college
Portugal.
words.
Yeah, for stuff like this. But you very astutely, very eloquently described this as a chronic versus an acute problem.
Right.
I was wondering if you could share a little bit about that, because I think it's important to this particular part of the discussion, because that's really kind of what they were wrestling with in Portugal, which is like, wow, we have this chronic problem of overdose and death, and then how do we move people, you know? So I'll let you do your.
So I think with any issue that exceeds the scope of law enforcement, you're talking about the mandate that law enforcement has, which is to respond to and abate acute issues in our society. The best way I can compare it, what's a firefighter's job? To put out fires, right? They show up and they put out fires. Police do the same thing, just not with literal fires. We're there to be kind of the wave and calm in a sea of chaos, and sort through these acute issues. And in a society that functions well, you then have the ability to hand those now resolved acute problems off to partners. And that is really how our government is structured. And as we've added mental health issues and houselessness issues and addiction issues, police have been left to try to solve these problems, and it leads to bad outcomes. One part of Measure 110 that's really important that isn't mentioned very often, and where I think it's very different from Portugal, another part and a big part of Measure 110 was the approach to navigating disparate outcomes in our society to addiction issues. And this is where partnership is so important, because those disparate outcomes connect to law enforcement in a very significant way. And so us having partners to hand off the work to, once we get to chronic, you know, I can call Fernando on the street and say, hey, I have someone who's suffering from addiction. There's no criminal justice nexus here. We do need to kind of abate this issue because people are calling and this person is in need, but they're asking for help. Can you come right now and help me solve this problem? The same thing with mental health care. You know, having a BHU unit, having people who can respond, understanding that the police nexus has ended, but the touch points exist, and we need to be able to hand those things off. And that's where you know, I think the real damage in 2020 and 2021 was, I think, the mistaken notion that we should work to separate law enforcement from the community, when in reality, we need to be working to connect the law enforcement community to our service community, so that you know, that overt work can be done.
So you used another acronym. I'm going to ask you to say what that is. BHU.
I'm sorry. We all come by it honestly, right? BHU is the behavioral health unit. So one of the things that came out of the kind of government agreement that we have with the DOJ was the kind of formation and formalization of having a unit within the police bureau that is solely focused on response to calls involving people suffering from mental health issues.
Thank you. So let's stay on this a little bit, because I think one of the things that we heard about in their structure is that when somebody is encountered who is either using in public or has paraphernalia on them, what the police will do is they're not arresting them, they're not giving them a criminal engagement, they're making a referral to the Dissuasion Commission. Fernando mentioned this a minute ago as well. And the Dissuasion Commission is made up of mostly social workers, a lawyer for compliance to the system. And then that commission is meant to kind of sit with that person, get to know them a little bit. And I loved this phrase, make proposals for things that they could get engaged in that could potentially improve their lives. Now, we heard a lot about the Dissuasion Commissions when we were there, but we didn't actually get to see one. However, Fernando stayed after a little while on the trip and did get to see a Dissuasion Commission. So Fernando, tell us a little bit about what you saw.
Yeah, and there's some video of it on YouTube, by the way, of one of them sort of, because they do have confidentiality and all that good stuff. But yeah, basically the process, and this goes kind of back to what Aaron was saying, that when you have an engagement with a police officer, if it's determined that it's not trafficking or sales, and they went hard after trafficking and sales, like they really threw a lot of resources at that. But if it's not that, they're going to confiscate your supply. And then they're going to give you basically a summons is the best way I think to conceptualize it, that you have to go to what's called the Dissuasion Commission. So if you imagine two separate paths, on one side you have a law enforcement engagement, and you'll go to the courts with the judge and all that stuff. The Dissuasion Commission is through their public health department. And it's a committee, basically like a tribunal made up of 3 members, as Mercedes mentioned. So there's a lawyer for compliance to the law and to the administrative piece. There is a social worker and a psychiatrist, and both those mental health professionals are people who are experienced with diagnosing or screening for mental health disorders and for substance use disorders. And then a person is told to show up, usually within 3 to 5 business days. So the access is really quick. If you can't make it, you can call and say, hey, I need a different appointment. If you don't show up, they'll send you another summons to your home a second time. If you don't show up a third time, they're going to send the police officer to your home and be like, hey, here's a summons. You really need to go do this. So person goes to the Dissuasion Commission, they check in, they fill out some paperwork, confidentiality paperwork, all this kind of good stuff. And then they sit with one of these mental health or behavioral health professionals to do formal screenings. And they used evidence-based practice screening tools that we have access to in this country, that we know are really great at like letting a person know if they need to go for further assessment. So the difference between a screening and an assessment. Screening is, do we have symptoms enough to think that you might need a more formal interview to see if there is something diagnosable here? And then if a person turns out yes, that person then gets referred to and connected to what they call reintegration services, what we would call case management services or wraparound services in our country. And this person helps them access whatever services they may deem necessary in that situation. It could be anything from treatment for their substance use disorder, harm reduction interventions to prevent them from overdosing and dying or getting an STI, sexually transmitted infection. It may be housing, education, work. The stuff they did around work is also really clever and amazing. But that's what the Dissuasion Commission's job is. Each interaction with one of these people takes maybe 35 minutes, so it's a relatively quick process. They happen throughout the day, Monday through Friday, 9 to 5. They don't happen in a court or in a police station or any sort of judicial anything, legal system, anything. It's completely through their public health system. And so that's kind of what that process looks like. And honestly, as somebody who had been studying kind of the law for so many years, not like I'm an expert or anything, but I'd always just heard that, but wasn't sure what it was like. And when I actually saw it working, I was like, wow, this is actually kind of the innovation. This is the thing that is so radically different from the approach. I know everyone thinks that decrim is, but in the United States of America, drugs were basically legal and decriminalized until like the 19-teens, basically, the 1920s, when the federal government started sort of passing broader laws. But it's this Dissuasion Commission public health approach that really kind of was like, man, that's
Dude,
how do we do
Fernando, I
that?
wish I would have loved to have been able to sit in on that, though. A delegation of 24 is probably a little too many.
Yeah, and the room that they have it in is kind of small too. It's very clinical. There's like a glass between the person and just like a way to
Mercedes, if
talk.
I could ask him a quick question. Fernando, is that okay? Do you have a sense that they have enough resources so that if someone wants employment services or housing or some sort of more formal kind of drug addiction treatment, they can get it? Because I think that's what our challenge is.
That's a tricky question because the word is, the word you used was enough. I don't think there's ever enough, right? That's the thing. We're dealing with a chronic health condition that's got lots of genetic and generational components to it. So I don't know if there's ever enough. They definitely have a more robust system than we do. And again, this was that pragmatic approach. I don't know if you guys remember, but we were in kind of meeting with their public health officials, and very pragmatic questions came up from some of our elected officials around, well, our problem is we don't have enough housing. And they were like, well, then you build more housing and make it accessible. And they're like, oh, well, I don't know. Like, well, the problem we have is public use. And I'm like, oh, okay, well, if public use is one of your issues, you build more safe consumption sites so people are not using on the street. And they're like, well, we can't do that. And you're like, well, these are the pragmatic solutions to these systemic problems. And so the issue of enough, no, we don't have enough. I don't know that they have enough. I don't know that anyone will ever have
They seem to
enough,
have more.
Yeah, I
but
think
they definitely have more.
Yeah, I think the one thing that's important to remember too in that same conversation, he said we're not the model, we're all rats in a different maze, right? And I
Right.
mean, and that is what's so difficult is that I think one of the questions in the chat here, asks about, kind of comparisons culturally. That it really is very clear to me when we were there that there was not a big debate about kind of societal accord around people being allowed to suffer in public. And I think that's been the real difficulty here in Portland and especially with the manifestation of fentanyl, and they're just fentanyl and the kind of meth that we have here aren't present in Portugal. The degree of real suffering that we see on our streets is different. And figuring out, we have a society that I do believe is very benevolent and does not want to, have the government effectively manifest itself on people in a way that hurts them, but it's a pickle, because then how do we also ensure that they're getting the help they need? And so, it is difficult to figure out how to take the exact system they have there and bring it here. But I do think that the one big takeaway is their government and their responders are cohesive. Their responders that are in America, that are the community-based groups that are, are nonprofits and everything else, they all work for the same government. And so to me, that necessitates, again, a very woven approach here in America, because if we're spending tax dollars on policing, we're spending tax dollars on nonprofits, we're spending tax dollars on all these different things, it's really important to ensure they're working together. Because I think the one big difference here is that they're not mandated to work together because they don't all work for the government, which is what it is, and fine or not. But so I do think it's important to ensure that when the government is spending money, it's spending it once and it's spending it well.
I mean, okay, Mercedes, this is a little bit of a rabbit hole, but like, I think one of the things that we struggle with here in the United States in trying to implement a model that Portugal has is we have a federal government, we have a state government, which is pretty much non-existent in that country. I did not see the equivalent of county government. There's city government, but like the education system is federal, the medical system is federal, even the policing system seemed kind of federal to me.
It is federal, yeah.
And so the actual cop understood that. So like that, I think that honestly, like, is no surprise to City Club listeners that some of our challenge around here is getting all of these different levels of government that we have here in our state to sort of play well together and coordinate.
This comes up a lot, and you all have heard me say this multiple times, and the people in this talk have never heard me say this. All that is true and accurate and correct, and they absolutely said that our problems are not your problems, and you have to just like set a strategic path and follow it through. They certainly have things that they have in place structurally and systemically that made it easier for them to do what they did than what we have to do. But I disagree that that's the barrier. The barrier we have is that we have a lack of strategic planning. We seem to think that money is the solution to all our problems in this country, and that if we just throw enough money at it with no actual strategic plan, to Aaron's point, we're just throwing good money after bad.
Okay, but we also throw a little bit more money at this problem. Okay,
absolutely.
Like I want to be very clear to City Club viewers and listeners, okay? Spending only $300 million in a biennium on addiction services and supports that complement what we're doing with commercial insurance or the Medicaid program is partially why we're struggling. Like, that's actually not enough resource, I would argue.
Yeah, I don't want to make it seem like we're not spending enough, like we're spending too much. What I'm saying is that we need a long-term, this is generational underfunding and mismanagement, right? That of a system that is basically failed. Our system it's collapsed. It's failed. Our hospital systems are literally suing the state for being forced to take clients that need to be civilly committed because the state hospital doesn't have enough capacity, right? The police, Portland police is understaffed. And they're being asked to do an impossible job with not enough resources. Our system is not robust enough. And the difference is they decided as a society that they were going to address a very real problem systemically and see it through over years, right? As Mercedes did the timeline at the beginning of this talk, we're 18 months into something that's never been done before. And it's kind of world breaking. It's at least country breaking. It's never been done before. And so to just like pull resources out and to just like switch course, just as we're starting to kind of take the first meaningful steps. You can go on the Measure 110 OHA dashboard and tens of thousands of people have accessed care, right? There's been hundreds of thousands of interactions with services that have been funded through Measure 110. That doesn't get reported in the media. You never see that. Honestly, as a treatment provider, as a services provider, sorry, I'm not a treatment provider, but we do recovery support services. It's painful for us that every article that you see is a person downtown smoking fentanyl when they're not showing the thousands of people that have accessed care, who've had screenings, who've gotten into recovery support services, who've gotten housing, who've gotten into treatment, who are then now succeeding through these services and taking the next steps in their lives. So it's working. And I know that we have to address it. Let's call the elephant out. What we're really trying to address is a homelessness crisis in downtown Portland.
Okay.
Well, let's bring it into, I think, actually prevention, right? Because I think we had a ton of audience questions that were about prevention. A lot of what we're describing right now, right, is part of that prevention. Like there are a lot of people who begin to experience homelessness and then begin to use as a way of dealing with the trauma of experiencing homelessness. And we just kind of continue to see that. And then we criminalize both their existence for being homeless and now interest in recriminalizing their substance use, right? We kind of drive it into the hole. But if we pull back and we ask, how do we actually just get healthy communities, right? What is the prevention that we saw in the work that Portugal was doing? I know some of the presentations of the new joint commission or committee also saw that we don't really put a ton in prevention as far as like prevention specific activities. So thinking about what you saw as far as prevention strategies in Portugal, what would you like to see here in Oregon?
Well, they do have more housing I mean, they're experiencing housing challenges as well. The country is suddenly very popular and the cost of living is not as high as other places in Europe. So but they don't have it, I don't think, as acutely bad as we do. I can't say enough about having some sort of universal healthcare system. They have some challenges with the way it operates as well, but you have one level of benefit if you're on a DCBS, that's Department of Consumer Business Services regulated plan, versus an ERISA plan, which I don't even remember what that stands for, versus Medicaid versus Medicare. All right. We just have a ton of variation in our health insurance because of the way that we provide it to our population. So those two things. And then I don't know if maybe Aaron or Fernando would be a little bit better to talk about, but we got a pretty intense briefing as well about the things that the police do in the schools, which maybe we're doing something like that. And forgive me if I just don't remember that my kids got that when they were in PPS. But the police are in charge of kind of coming and giving talks to, seems like all level of age groups about the consequences of using substances in harmful ways.
Well, it will surprise nobody as the last sergeant of the Youth Services Division that I feel very strongly about the work that is done in schools. And again, I mean, I mentioned a little bit earlier, you go back to what Portugal went through as they moved out of a dictatorship and into a society that was, newly discovering its relationship with its government. In 1985, we were told that the government and law enforcement's response was to create 285 school police officers, and within a group of 1,000 police officers that were all set up as community agents, as a participatory agreement with society. And I mean, they had a mascot, which it was Falco the Falcon, which I still would love to get.
That's still their mascot. Yeah.
I want a mascot, but they created an environment where people had safe and non-crisis access to law enforcement in every walk of life to ensure that when people are in crisis, they know kind of what that societal agreement is. And it's just so hugely important. In doing our school police here in Portland, it was such a deep and abiding relationship. And it's a tragedy, in my opinion, that we don't have that relationship anymore. But a big part of that was education about addiction. They talked about how they have whole programs to educate young people about the outcomes of addiction, where it can lead you, how you can stay clean, stay safe. And I do think that leads to now 20 years later, a society that has a different understanding about what narcotics are, the impact. And again, in the absence of fentanyl, I mean, fentanyl, if you look at the way it's manifested itself everywhere it exists, it washes over a country, it comes in as an adulterant, it then becomes a drug of abuse. We're seeing in Oregon now, it's becoming an adulterant again because the cartels are concerned about the pricing because fentanyl is so cheap. There's a lot of stuff there to unpack, but at the end of the day, law enforcement can play a very important role, but it's just a part. And a lot of that comes from that trust and that kind of agreed upon cultural relationship with the government.
Yeah,
I
Aaron,
want to add a little bit there because I think it's important also for our audience to know that the presentations that the Portugal police were doing in schools were not just about drugs. They were also talking about animal welfare, how to cross the street appropriately, cyberbullying, healthy relationships. So they had developed themselves as a trusted voice on a whole host of safety precautions, of things about how to keep your body and your community safe. And I think that is much more than drugs. They even showed us that the number of presentations they do around drugs was not the majority. It was not like the largest bar chart there, right? That there's a huge different sense of what police are there to do. And I kind of want to pull on this a little bit more because I think it's an interesting thought, right? Like when seasons change, I'm doing checking questions with my staff, right? When seasons change, we're like, what do you do to keep warm? What do you do to cool off, right? We essentially have to change what we're doing to adapt to our environment. Aaron, I want to know from you, what do you think that police should be doing to adapt and embody a health-based approach?
Well, and again, I mean, Fernando and I have discussed it at length. The reality is that I think if our responsibility, and I believe it is to abate acute issues and be a good warm handoff to services, when we're navigating any situation, we need to identify, again, what's the acute issue? Is it criminal? Does it evolve in the criminal justice system? If so, we help the victim navigate that. We help the subject navigate that. But also, we back up a little bit and say, why is this happening today? If there is a root cause issue there, if there is an addiction issue, a mental health issue, a houselessness issue, an abuse in the home issue, whatever, that we also are manifesting good outcomes by having partnerships that are available in real time. Everyone that I've spoken to on this trip talks about, I think it's very similar with mental health issues. When someone is experiencing a crisis in their life, but they're in clear mind in that moment, they need help right then. They don't need help in a week because in a week they may not be in a position to accept that help. So we need in real time those partnerships. And, I hear very often from some service providers that law enforcement is a barrier to this, that, or whatever else. Even in a world where I agree that is sometimes true, our touch points are so frequent. And so it is, even in a world where those touch points might be negative, giving police officers the ability to triage and abate, but also move that problem to someone who's better suited to solve it in real time is the solution. And many of our ideas in the last couple of years have served to separate law enforcement from the service community instead of connect it. And that, I think, is a mistake.
I definitely hear that. And I think part of the tension, right, is does it have to be a criminal engagement to have those warm handoffs? And I think those of us who are working in community really want to see that that's not necessary, that that's not a component of the process, that we can still have trusting and healthy relationships that connect people to long-term care without first putting them in that box.
Yeah, and I mean,
since we're getting a little bit towards the end, though, I do kind of want to go to another audience question. We had several audience questions that were like, what's happening with the money? Where is the money? What's going on? So Fernando, I'm going to put you on the spot and I'm going to ask you to share a little bit with us about what your organization has been able to do with just 1 year of Measure 110 funds.
Yeah, thank you. Actually, it's more than a year because we got a part of the access to care. Has that been more than a year at this point? Yeah.
That would make it 2.
Yeah. So in August, 2 years ago, we were part of that access to care grant, which allowed me to do something that's very difficult to do with culturally and linguistically specific services. So our organization provides low barrier, no cost recovery support services, harm reduction outreach services, training, education, warm meals for the Latino community in Oregon. And one of the hardest things to do in a system that, where the school to prison pipeline for BIPOC communities is so pronounced as it is in Oregon, is to find leaders with the education and experience in serving the community that are also bilingual and bicultural. So the access to care allowed me to actually hire a director of services so that we can actually begin to hire line staff and build out services. So that's the first part of Measure 110 funding. And then when we got our full funding, we did another thing that's very, very key for people who are both in early recovery or still in contemplation about recovery, but also that are just locked out of the social safety net or because of language barriers or insurance barriers aren't able to get services, which is hire case managers, culturally and linguistically specific case managers. Currently, as of our most current report, our case managers have helped, there are about 156, 57 people a month. That's unique individual Latino people in accessing medical services, detox services, treatment services, aftercare services, food assistance, harm reduction outreach and engagement services, education, housing, kind of all of it. We've also been contracting with an immigration attorney that's helping a lot of these Latino people get their work permits so that they're moving from kind of just needing to always be accessing care to being able to support themselves and then supporting them into housing. And so, I encourage everyone to go on the Oregon Health Authority Measure 110 website, and you
I
can
was just
literally
going to make a
see
plug
that,
for that, so I'm glad you did.
yeah, for peer support services under number of engagements in Q3, they say 57,000 people across the state of Oregon got services. And this is one of the heartening things. I don't think that anyone that was on this trip with us is talking about getting rid of the services, right? And let's remember that the measure initially passed because the voters in the state of Oregon were deeply, deeply concerned and had enough with the failed war on drugs, which disproportionately affected Black, Brown, and Indigenous communities, and increasingly rural and poor white communities as well. And so basically, we overcharge, we over sentence, and then we saddle these communities with all these barriers exactly at the moment where they might be trying to get clean and sober. And then when we try to move them through the system into recovery long term, they hit all these walls and all these barriers. So that's part of the decrim. That's actually what the goal was. And then this, unfortunately, we took that language out of the measure once it finally passed, and it's kind of disappeared from the conversation that this was because we have a system that disproportionately affects the most marginalized people in our system. And so that's more than the question you asked, which I can.
No, that was great, and I appreciated that last piece that you shared, because I have also heard it from a prosecutor in our community that like the consequences of criminalization usually don't really hit people until they're about a year into their recovery. They're trying to get that new job, they're trying to get that lease on a new apartment, and suddenly all of those things that they were supposed to be doing, all those fees and fines that they collected, now they're starting to impact their life, right? Kind of right at the moment when we don't want them to. And so on that last point, this will be kind of one of our last questions to take us out. And there was a couple of questions about this in our Q&A and our previous audience questions. They're really about coordination. Because I think what we saw in Portugal, and Representative Noce, you mentioned this, so I'll ask you to kind of start on this question, is that there was a bit more of a unifying force between the government and their partners in what they were trying to accomplish and how they were trying to accomplish that. So given what we've learned in Portland, and all of the various people who are involved in this issue of treatment, recovery, and decriminalization, from policymakers to community members to providers, what can we do to be working better together and moving ourselves in the same direction? Representative Noce, why don't you start us off?
I mean, I think the various branches of government that we have, the county and the city and our state, need to get in a room and argue out about our delivery system a little bit better, so that Aaron and Fernando have more tools and more direction. So it is disappointing to me 2 Sundays ago in the printed version of the Oregonian, maybe it's 3 now, there was a story about how for 4 years, we had groups of people trying to sit around, figure out how we could stand up a more robust sobering center that would meet the moment in terms of the kind of drug challenges and addiction challenges that we're facing. Washington County was doing the same thing. They're launching theirs, and ours is kind of gone kaplooey and is, I'm sure, is a binder somewhere on somebody's shelf. So I think that is part of our challenge, I think. And if we were doing that better, I think there'd be less pressure on changing ballot measure 110 in ways that I think might have unintended consequences.
Thank you. Fernando or Aaron, what can we be doing to be going more in the same direction?
So and Fernando, if you want to go, I can be away. For me, I have been having a lot of conversations publicly about how do we necessitate interaction, and you know, I look at like Airbnb, right? If you want to stay somewhere, you can then go onto your app, and you can filter through all of your specific needs and find a house in a random place today. OHSU has bed counts. All the hospitals, if you're a paramedic, you can call and see who's open. The fact that we don't have necessitated coordinating applications where any person in the response community can say, you need help culturally specifically, what do you need? You need someone who speaks Spanish, you need somebody that can accept kids or dogs, whatever else. And we have an app that we can go and look and say, this is the bed count, this is the resources we have, and find a place to send someone. If you ask the police officers in the street in Portland today, right now, you have a person who's experiencing addiction, what can you do with them? They're going to stare at you and they're going to blink because we don't know. And the biggest reason is the breaking of relationship. And so to me, the number one thing we can do is find somebody at Portland State who's working on coding to write us an app that gives a real-time bed count for all of the things that we need, all the services. And then we turn to all the people who are accepting tax dollars and say, we need you to update this once a day. If you want tax dollars.
Aaron, someone is working on that.
Good, because I've
We
been
had
saying
a briefing about it. I can't tell you where it's at, but I know that that's a thing.
I don't want credit, but it was my idea.
Okay. Someone else is working on it.
But yeah, I just.
All right, how about you, Fernando? Oh, no, sorry, go ahead.
No, go ahead. I just think that the necessitated interaction between all of the services we're paying for is it for me.
Yeah, I'm debating how to answer this question. You've heard me say it a little bit already. We have to start looking at the people. We all agree that we want healthier, safer communities. We want our neighbors who are struggling and who are suffering to get the help that they need. We just sometimes disagree on how to get there. And to Aaron's point, if we're not talking to each other, we're not doing anything. And then we also, as a state, need to recognize that the system has failed. It's not like we have a puzzle that's missing 1 or 2 pieces to be a complete picture. We don't even have a table to build the puzzle on. And so what we need to do is start thinking long-term and strategic. You mentioned 1971. Let's remember that no one talks about 1968. The last thing that Lyndon Johnson did was pass the Safer Streets Act Omnibus Crime Bill, which started to undo all the funding that the New Deal did for all the social support programs, which set the stage for 1971 to happen. As soon as we started de-investing or taking the investments out of social safety nets for the communities and investing it back into safer streets, all of a sudden, people who had access to services, they stopped having access to those services and crime went up, and then the necessity for more police and the more prisons, and here we are 50-something years later. So this disinvestment was strategic, it was long-term, and what we need is the same approach to a healthcare system. We need partners in the government that want to be partners, not just regulators and administrators of a system, right? We have counties in this state that don't have detox, that don't have pharmacies. I'm also a member of the opioid settlement board, and we heard from the special districts and our first responders, like these people are putting it on their line for their communities. They don't have they don't have enough ambulances to even get to all the overdose calls that they're getting. And so really, at the end of the day, what we need is a long-term strategic approach. We're going to have to be honest with the voters, with the communities, until we actually invest in building out a system that can get closer to meeting the need. Recrim is not going to do anything. We heard this in Portugal, right? Recrim or decrim by itself does nothing. We need to actually build out a system. And then to Aaron's point, we need to work with our first responders, and we need to realize that also I'm pretty liberal, progressive, but I know that our conservative and Republican, brothers and sisters in the House and our electeds, like they want the same things. We have to honor the work that they're doing. We have to honor the work of the police and the first responders and the work and our providers, and really make a push strategically. We need to be looking. One of the people with us, Mark Harris, says, it's okay, I think in 7 generations, right? He was quoting, I believe, an Osage Indian proverb. It's like, we need to be thinking in 7 generations instead of 7 weeks.
Thank you so much, Fernando. And I really appreciate all of you for taking the time today to share your experiences, share your hopes for our future and our ways that we can continue working together. And a good reminder that it took a long time for communities to be hurt, and it'll take a long time for us to heal, but that it's all possible, that we're doing this work together. We're caring people, caring about our community. Thank you, gentlemen, for all the care that you bring to your communities. And thank you, everybody who joined us today. Thank you, City Club, for hosting. I hope everybody has a great day.
Thank you.